YouTube. Hello, my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, March 15th. It is time for a live support group meeting. Granted, it is chaos everywhere right now. And so let us just see if anybody happens to need support today. Hello, YouTube. I see you down there. So if I'm looking up here, we're simulcasting live on Facebook and YouTube. This is a support group meeting for men and women struggling with interstitial cystitis and chronic pelvic pain. Hello, Cindy. Hi, Shirley. Now, I have been gone for a couple of weeks because I had to have unexpected oral surgery that included, and look, you can still see the swelling. Like I still have swelling right there. I'm missing a tooth. I had an old root canal become abscessed. Every single root was abscessed. Oh my God. And when the surgeon, they couldn't save it. So when the surgeon drilled it out, he had to go down and drill into my jawbone. It was crazy. So literally, I've only been talking now without pain for maybe 3 days. And we'll see how long I can go because air going over that is not the happiest thing. Hello, Amber. Hi, Susan. Hi, Mihaela. Hello from Romania. Oh, it's so nice to see you. I'm so glad you could join us. Man, if there's ever a time where we got to stick together, my friends, it is this time because we are dealing with some unprecedented things going on in the world right now. Hello, Don. Yeah, definitely starting to feel better. But I got a big hole right here and it went all the way down to my jaw. And so you can still see my swelling. I had a lot of swelling there. Oh, we're not the young kid anymore. All right, so let me introduce myself. For those of you who don't know me, my name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. I'm the nation's longest serving IC support group leader. I have been serving as a support group leader since 1993. Hello, Betty, 27 years. I'm now the national IC support group leader. I bring support group meetings online in part because I want to make sure that you're getting the best information you can get. The IC Network, my company, is rated #1 in the world by Harvard Medical School and the University of London for accuracy, reliability, credibility. I bring to you 3 college degrees. I have a degree in chemistry. I have a degree in drug development pharmacology. I have a master's degree in psychology, and I could not do my PhD because my IC started. I could not sit in a car. Ironically, the IC Network, icnetwork.org, was my doctoral dissertation proposal on how to bring support to patients who were homebound. And I'm really proud that 27 years later, we continue to be #1 in the world. I will tell you in terms of credentials, this is my job. I do this every day. I read medical journals almost every day. I sat on the U.S. Army IC research panel for 10 years, representing you, the IC patient. My goal with that, doing that service to our patient community and to the U.S. Army, was to represent what patients need. And one of the things that's really important to understand is that, IC research has improved so dramatically. It's amazing how far we've come. The last 5 years have been spectacular. The last year has been spectacular. But when you spend time with geeks, because a lot of researchers are geeks, I kind of consider myself a geek. And let me just do a sound check here. I hope the sound is okay. One of my purposes in serving on that research panel was to ground them into what patients need. Because you know what, like the science is really interesting. Like how the hell can a bladder hold ammonia for hours at a time and not get damaged? Which is, think about it. The bladder is the only organ in the human body designed to hold toxic waste. You ever think how can the bladder hold ammonia and urea and all sorts of things for hours and hours and hours at a time? And the answer, of course, is that the bladder is a mucous membrane organ, just like your mouth. It is covered with a nice, thick, robust coating of mucus. We call it the mighty mucus. And when you have a lot of mucus, your bladder can defend itself. When you have less mucus or that mucus is damaged, guess what? Your bladder can't defend itself. Urine gets deep into those tissues where it causes damage. I'll just give you a little, I'm sure we'll talk about this in a bit, but when we think about bladder injuries, really, we're really thinking about two, maybe three types of injuries. Injury number one is some sort of chemical exposure, like chemotherapy. Or if you spend a decade drinking diet soda, artificial sugar is really well known to be an irritant. Or if you've used ketamine, ketamine basically almost acts like an industrial solvent and it just strips the bladder wall badly. So when we think about the health of that mighty mucus, we're going to look at chemical exposures. We're going to look at the quality and health of your skin. Your skin and the quality of health of those tissues. So if you're struggling with dryness, if your hormones are messed up, there's always a small subgroup of patients whose symptoms are really being driven by hormones being screwed up. So if you have very, very low estrogen, if you have had a hysterectomy, especially early on, you might not understand the long-term ramifications of estrogen loss is that mucosal barrier gets thinner and thinner and thinner, and your bladder's ability to defend itself is provoked. And then, of course, we have to look at the role of infection because infection happens. I will tell you that in the last 27 years, I've only had two bladder infections. One we thought I thought was a flare for 6 weeks until it hit my kidneys, and then oh man, I was toast. And I don't remember what the other one was. So it's possible that IC patients can get an infection, especially if you're self catheterizing. However, another area where we've really grown and learned a lot about IC is in the area of fungal infection. We now know that many IC patients struggling with flares have an overgrowth of candida in their urine. Who knew? When you think about infection, you think bacteria. Well, guess what? We're beyond that now. We're thinking about fungal infection. And I hate to say the word, I feel like, not that we're going to drink here, but I feel like every time we have to say the word virus today, we should take a shot of something. But I'm not advocating you drinking. But we certainly do know that viral infections can also affect the bladder, especially the Epstein-Barr virus, right? Which is part of mononucleosis. So we've come a long way. There's tremendous hope to be had, my friends. We're getting it. We are absolutely getting it. Now, I normally do these meetings in three sections. I will do an educational riff for 30 minutes to an hour. Now, please remind me to drink water because, hello, if I don't drink water, I am screwed because of this damn hole in my jaw right now. Then I will take your questions for an hour or two. I don't know if I can go very long right now, again, because of the surgery. And then we will do a giveaway. Now, hold on a sec. I got to get a couple of things here. I got to get my flashcards. Where is it? Where is it? Oh, okay, that's part of it right there. And of course, I got to get this book because we're going to talk about this book. Alrighty then. Alrighty then. Denise says, what do you think about a hypogastric nerve, a nerve block? I have no problems with you doing a nerve block. We're now learning that, when we think about subtype, and you guys, just so you know, it's really gray here, and I've got a light on, and the light is changing like mad, and that's why my face is getting all shiny. All right, that helps. So anyway, we certainly now know, in addition to bladder wall injuries, we're now doing something called subtyping. Okay, why? Because we know that for many patients, if not most patients, we find structures outside of the bladder that are contributing to their pain. Now, how do we know that? Number one, a one treatment fits all approach does not work. So if a bladder therapy doesn't work for everyone, then maybe it's not the bladder, right? It's possible. And I know a lot of you have been told IC is an incurable bladder disease, but we don't think that anymore. We haven't thought that for at least 5 to 10 years. You're hearing that from doctors who haven't had new classes recently, right? We have a lot more new information that helps us understand. So, number one, if IC were a bladder disease, then wouldn't a bladder therapy work for everybody? And the answer is it doesn't. It only works for about, oh my God. Okay, hold on. I just messed my Hey, listen, it's not a support group meeting if something doesn't fall, and that includes me and my chair. Um, oh, hold on a sec. Oh my God, that's so funny. I do that. I do this almost every time. Okay, but this is a new chair. Okay, hold on. Wait, wait. I gotta figure this. No, it keeps going down. Come on, chair. Oh, okay. It's the bladder comedy hour, right? Oh my God. Let me take a drink of water. Okay, so if IC were a bladder disease, wouldn't a bladder therapy work for everybody? And the answer, of course, is you'd think, but guess what? It doesn't. And then you got to look at the physical reality. Some patients with IC, a small percentage of patients with IC, have big bleeding wounds on their bladder wall that we call Hunner's lesions. But others, like me, our bladders are perfect. You look at our bladder, there's no sign of dysfunction. Yet, was there any doubt that I had IC? None at all. I absolutely had IC. So, the presentation of somebody with a lesion or ulcer on their bladder that's bleeding versus somebody like many of you, they look at your bladder and your bladder's normal. Obviously, you don't have the same type of quote unquote IC, right? And then it's really, and of course, some patients have terrible pain, others have no pain. Are they the same? Probably not. And when you spend time in support groups, that's where you really see the diversity. Because for some people, IC begins in childhood, whereas for others, IC begins after menopause due to estrogen atrophy. So the childhood patient could be an injury patient or could be an inheritance patient, whereas the postmenopausal woman might be the estrogen atrophy patient. Are they the same? They're both called IC. Are they the same? Absolutely not. For some people, IC begins after having a baby. While for others, IC begins, for a lot of people, after some sort of pelvic trauma, like falling on your tailbone. Both diagnosed with IC. Here you've got all the symptoms of frequency, urgency, pressure, pain, but it began after a fall. And I can guarantee you, your bladder probably wasn't damaged when you fell. What was damaged when you fell was your pelvic floor muscles and or nerves and or blood vessels. Think about it. When you fall, let's say you fall on your hip. So your muscles are flattened, right? Bam, flattened. Think about the reality of that. So you have just taken a nice plump tissue and you flattened it. So you've squished the muscle fiber, you've squished and or potentially broken blood vessels because that's what causes bruising, and you've also squished nerves. Now, when you're young and robust, and you've got nice fresh tissue and nice responsive young people tissue, tissues tend to plump up really quickly. But you ever consider the legacy of a fall? What is the legacy of that fall? I mean, you fell damn hard. Quite a few of you remember trauma. Well, when you flatten the muscle, you weaken the muscle and you potentially damage the capillaries in the blood vessel. And the odds are you probably ended up with what we would call a latent trigger point, a muscle knot. Now, it's not bothering you, but it's there because y'all hurt the muscle. And one of the things that we consistently see in the IC patient population is a history of pelvic floor muscle trauma. So you might have jammed your crotch on the bar of a bicycle. You might have fallen when you were a kid on your tailbone. You might have maybe done a sport where we know pelvic trauma happens, whether it's ice skating or gymnastics or football or soccer, anything that involves trauma, God forbid it be bike riding, because we know that's going to cause direct trauma. Um, Eventually, everywhere you fell, you end up with these trigger points, latent trigger points. And then one day, something happens, and it might be very, 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 very minor, like having to be in a car for a long period of time, or a period of acute stress, or all of a sudden things turn on and you've got pain, or you've got frequency urgency. Because if you've got a damaged urethral diaphragm muscles, when those muscles start to spasm, you will get urinary frequency urgency. Now, of course, now you got to understand, you have no freaking clue you have a muscle injury. None at all. None. And then one day you got frequency urgency and maybe even pain. And you call the doctor, and the doctor goes, you say to the doctor, "Oh my God, I think I have a bladder infection. Can you give me antibiotics?" And of course, in the old days, they would say, "Sure." They just throw antibiotics over to you on the phone. But some doctors will say, "Come on in, let's test your urine." And so you pee in a cup. They might do a dipstick. Your dipstick shows positive leukocytes, negative nitrites, which is essentially a negative pretest for infection. But he goes, "You know what? Just to be on the safe side, let's give you some antibiotics for a couple of days, and then let's just wait for your test results to come back." So you walk out of that clinic, it's like, "All right, man, I'm going to get better. I've got antibiotics here. Let me shut these drapes." Well, guess what? The antibiotics don't work, right? The antibiotics don't work. So you go back to the doc. Well, okay. So remember, you think you've got infection. Oh, so I'm sorry, guys. The lighting is weird because it's raining outside. Um, Hold on. Maybe if I turn like this. No. All right. All right. So let me finish the story here. I promise this will make sense. Okay. So here you're absolutely convinced you have an infection. You go to the doctor's office. The doctor gives you antibiotics. And guess what? A couple days later, the doctor calls and says, "Hey, your urinalysis was clear. You got no infection." And you're like, "What the hell? Seriously, I'm peeing all night long. I got no infection. What's going on?" The doctor goes, "Well, maybe you've got overactive bladder." So they give you Detrol or Ditropan or Miratric. You do that for a couple weeks. Doesn't work. It doesn't work, right? You call the doctor back. The doctor goes, "Uh-oh, maybe you've got interstitial cystitis." And they give you the IC meds, the Elmer the bladder installations. And guess what? Man, your symptoms might, oh my God. Oh, that's so funny. You know what? It's because of my foot. Oh my God. Hold on. Oh, hey, listen, for anybody who's new, you got to understand things happen in my support group meetings. I've had 2 earthquakes in my support group meetings. You got to know that when there's a support group meeting happening with the IC network, things happen. Okay, so the doctor then says, I got to not put my foot over there. The doctor says, maybe you got interstitial cystitis, and they give you Elmeron, they give you DMSO, and they give you bladder installs, and you might be slightly better, but the problem is you still got frequency urgency, right? Like, what the hell's going on with my body? This isn't working. Now, here's the reality. Here's the reality. If you've got a muscle injury, a bladder therapy simply will not work. It might help reduce some of the symptoms, but it's not going to deal with the fundamental problem. And the fundamental problem is lack of circulation. You've got tight trigger points that are restricting blood flow to your various organs down there. And so your therapeutic priority for those of you whose symptoms began after a muscle trauma, your therapeutic priority is always going to be to try to restore blood flow. That's the goal. None of the tissues in the pelvis are going to be healthy if they're not getting good blood supply. And so our therapeutic priority for the injury patient is to restore blood flow. How do we do that? With pelvic floor physical therapy and to work on trigger points. Because if you've got a muscle knot, hi T Curly, T Curly's on YouTube. You're on Lyrica for the pain. All right. So T, again, what we want to really try to understand is what is triggering your pain. You are an anatomical mystery to be solved. Yes, it could be the bladder wall, but it could also be your pelvic floor. Or it could be a nerve dysfunction. It could be a nerve injury. I always tell patients, listen, number one, you are an anatomical mystery to be solved. When you go to a doctor, I always say, please do not walk into the doctor, especially a second opinion, and say how you announce you've got interstitial cystitis. Please do not do that. You will drop down the rabbit hole of their belief structure on IC. You got to walk in and be able to really clearly describe your symptoms. Hi, Mohammed. Nice to see you. And thank you for your kind words. Is your pain, number one, do you have pain? Is it inside your body? Is it outside of your body? Please don't just say, I've got pain down there. Oh my God. Be specific. Try to be as specific as you can be. Is it, again, inside of your body, or you can touch it with your finger, like at the exit of your urethra? Or is it, outside your body, or is it inside of your body? Is the pain to the left? Is the pain to the right? Is the pain in the front? Is the pain in the back by your rectum? Is the pain low? Is the pain high? What makes the pain worse? What makes the pain better? Now, here's one of the things you're going to see in a lot of support groups on Facebook is that a lot of people are going to say that they're diet sensitive. But there's just as many people who say food doesn't bother them at all. But they're diagnosed with IC, they got frequency urgency. The reason why food doesn't bother them is because their bladder wall, like my bladder wall, is healthy. Their fundamental problem is, in fact, muscles. So, do you feel a downward sensation? Do you feel an upward sensation, like somebody's pushing something up inside of you or something's falling out of you? When is it the worst? When is it better? Is there anything weird going on? Do you feel a fluttering sensation? Do you feel a vibration? And I think it's really, really, really important to be able to take a little time before your doctor's visit and go back in time, whether your symptoms started last year or last month or 10 years ago. Go back in time and make a list of the things that were happening back then. And especially trauma. Did you fall? Did you have surgery? Anything at all like that? I was working with a patient on Friday, and God, what was it? All of her symptoms began after a specific type of surgery, and I don't remember what it was. And in many cases, sometimes we even see surgical injury. I mean, like if you walk into the OR because you've got an ovarian cyst or an appendectomy or something like that, and you wake up with frequency urgency, that is not normal. And I know some doctors would say, well, you've got IC, and you're going to say, oh, hell no. Hey, man, I was fine before that surgery. Nothing happened. The only thing that happened to me was that surgery. So, what the hell happened during the surgery? Did anything happen? There are moments when, um, as an example, some patients are sent home from the operating room with a catheter. And y'all think that's normal, and that's not normal. If you're sent home from the OR with a catheter after, say, a hydrodistension, that usually means that your bladder was damaged in some way. Or if you've had a hysterectomy and you're sent home, this is very true with hysterectomy. If you're sent home with a catheter after a hysterectomy, the odds are your bladder was damaged during that hysterectomy. That's why they usually do a hydrodistension after hysterectomy. So, okay, so your ability to describe your symptoms especially the weird little ones that you might not think are related at all. Low back pain, neck pain, shoulder pain, eye pain, jaw pain, foot pain, anything at all like that. Try to be able to describe that to your doctor because it's all relevant. And then ultimately, we have what I call the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. I can promise you that in most of you, they're probably both involved to some degree, but one is normally driving the other. So if you're the chemo patient, well, okay, the chemo's killing your bladder wall screaming, your muscles are going to get tight to protect you. That is called the viscerosomatic reflex. Organs can affect muscles. Our therapeutic priority for the chemotherapy patient or the lady who was it? Oh my God, last week I was working with somebody who drank literally 8 cups of coffee a day. And she was still drinking 8 cups of coffee a day. It's like, oh my God, stop it. Stop it. Do we know that organs can affect muscles in that guarding reflex, that viscerosomatic reflex? But the larger group of patients that we're really believing now are patients whose symptoms begin with a muscle trauma. The muscles get super tight, the blood vessels get constricted, the bladder is not getting the blood flow it needs to be healthy, and then you've got nerves that are getting involved because those tight trigger points are squeezing nerves. Nerves are becoming dysfunctional. It's overwhelming the spinal cord with nerve dysfunction. And because the nerves are shared through proximity, the bladder nerves start to become irritated, inflamed, and we see those now sick nerves damaging the bladder wall. In that case, that is what we call somatovisceral reflex. That means muscles are changing an organ. And our therapeutic priority for that patient, yes, you got your bladder walls breaking down, but it's breaking down not from an outside irritant, but from an inside process beginning with the muscles. So again, if you're doing bladder therapies and you're just not getting better, we got to take a step back and go, all right, what the hell's going on with the muscles here? Because generally, we see a lot of muscle involvement. And again, one of the ways that we've gotten so better in the last 20 years is that most urologists now immediately assess for pelvic floor issues. And if you've got pelvic floor issues, you've got to go to pelvic floor physical therapy. And you have to be prepared for the fact that it's going to hurt at first. When they do that examination, their job, so here's your remember, this is your pelvis. You've got muscles that go from the left to the right, front to back, low to high. You got blood vessels going down into your legs. You got nerves coming down your spinal cord, going into your legs. The pelvis is a very small, confined area. What they're going to do is with a finger, they're going to go in and they're just going to touch muscles. They're going to go low muscles, medium muscles, and deep muscles. They're going to touch front and back and low and high. And if they can touch a muscle and trigger your pain, hallelujah, baby, that means they found it. This is fantastic news. You should never, ever, 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 ever be afraid of pain when you go to the pelvic floor physical therapist. Because if they can touch a muscle and trigger your symptoms, that proves that your symptoms are being probably driven by muscle dysfunction. I got an email today from somebody. I want to read this to you. Hold on a sec. Let me see if I can find this real quick. Was it an email or was it a message? Let's see. I did it on my phone. This was somebody who went to pelvic floor physical therapy the first time and it hurt. And the pelvic floor physical therapist got pretty aggressive with her and did a lot of work that first appointment. That might have been a little bit of a mistake. Generally, with your pelvic floor, you've got to go really, really slowly. These muscles have been messed up in many cases for years. You cannot expect them to respond after just one physical therapy appointment or even 3 or 4 physical therapy appointments. It's going to be a journey of you restoring muscle health. So anyway, in this case, this was a patient who said, "Should I go back? It hurt." And I went, "Hell yeah, go back. Just tell him it hurt. You've got to tell him how it hurt. Tell him how you feel." I would really love to find this email. Where the heck is it? Here it is. Here it is. So let me read this. Last week, I had my first session with a pelvic floor physical therapist. She did an external and internal exam. She gave me a list of things to do at home, breathing exercises, massaging, voiding log, and advised me to continue my estrogen cream. She did abdominal massages on me as well as internal massaging of tight muscles, also massaging of my sacrum. She said my sacrum is slightly over to one side. And ironically, we see that. We've seen that. The whole week after the appointment, I've been in a pretty substantial flare. I go back again tomorrow. Any advice? And the advice I said to her is, yes, I believe you should go back and tell her the pain you've had. Pain is a good sign because it means she found the problem and was working in the right area, but now you've got to go slow and steady. The abdominal massage might be a bit aggressive at first. Just tell her where it has been painful so that she could figure it out. This isn't going to happen overnight. Muscles have been messed up for months or years. They will be resistant to change. This is going to take time and effort. Abdominal massage is, in my opinion, too aggressive to start with. I only started having abdominal massage probably 6 months after we started some of my other stuff. And with abdominal, I don't think I can demonstrate abdominal massage. They basically come from the front, right? And they will kind of like work by your hip bone. Oh God, I wish I could do this. I wish I could show you. Um, one of the pelvic floor attachment points is right on the inside of your hip bone, right? That's part of your pelvic floor that attaches there. And if you put your fingers on the inside of your hip bone and push in and it hurts like it does right now, oh my God. Wow, it really hurt. Oh, on my right side. Holy hell. Woo. If you can if you can push in there and it's uncomfortable, that means that you've got a tight muscle right there. Holy moly, I got a tight muscle on my right. Okay. Yeah, my left side's tight too. I haven't done my pelvic. Oh, well, okay. Clearly, Jill Osborne needs to do her pelvic floor work. Um, I had one lady in Florida probably 10 years ago go to, who did she go to? It was like a osteopath, something, something, something. Anyway, at her very first appointment, man, the guy just dove into her belly and started really aggressively massaging those muscles there and hurt her like hell. Oh my God, she was so badly hurt. Going from the front is more aggressive, and generally you wait for that. I have only had one physical therapist do it, and it was fascinating because he was actually getting to the psoas muscle. Um, so it's a slow, gradual process. But the point that I'm trying to make here is that there are layers. Sometimes there are layers of dysfunction that we've got to work through. So, hey guys, first of all, before I take your question, well, let me take a couple questions. Then I have uh, two product reveals. I always like doing product reveals, and one is super sweet. Okay. And I haven't eaten today, and that gives you a clue. But let's just go ahead and take a couple of your questions. So if I'm looking up here, I'm looking at Facebook. If I'm looking down here, I'm looking at YouTube. So hold on a sec. Let me see. So Denise says, what about urinary retention? Generally, urinary retention is caused either by super, super, super tight muscles or maybe a nerve dysfunction. So the only times that I've had really interesting, kind of aggressive urinary retention is after an IBS flare. If you ever have gone through food poisoning where your bowel is just spasming as you've got the runs, you will notice that when your bowel is spasming badly, it kind of locks down, and you might find it difficult to urinate for 5, 10, 15 minutes after that because all those muscles are super tight and it takes that time to relax. So when we see a lot of urinary retention, we generally want to start looking first at the muscles. Nancy says, I hope you're doing okay. Yes, we'll see how long I can talk. I have a big hole right here. Oh, God, that hurt. You can see my swelling. Ooh, okay. T Curly says you're on Lyrica from the pain. So T Curly, I think, man, you got to do what you got to do. We're all against suffering. The American Urology Association says that pain should be assessed at every appointment and treated compassionately, including with the use of opiate medication if necessary. And I will tell you, I took opiates for this jaw surgery that I had. That said, we always want to take a step back and try to understand what's triggering the pain. It's important that you've got that. I mean, we're dealing with the symptom. The pain medicine is about the symptom, but you should always be asking what's causing the pain. What can we do to help improve that pain? So Rube says, my father is feeling so much pain all the time and releasing blood clots in the okay. So listen, that's bad. If he's passing blood clots, that means he either has bleeding Hunner's lesions or he's got infection. I don't know what country you're in, but at a minimum, or he could even have bladder cancer. That's an immediate call to the doctor. You should have a urine cytology test just to make sure that there's no bladder cancer in there, because bleeding is sometimes a sign of bladder cancer. But far more importantly, we want to get somebody to look inside the bladder to see what's bleeding. Like, what the hell's bleeding? If there is a lesion or an ulcer that's bleeding, they can cauterize that, and they should be cauterizing that or injecting it with a steroid. But anytime you're passing visible blood clots, that is pretty much an emergency situation. Maybe an urgent situation. And I would be very aggressive, very firm with your doctor and say, this is not normal. I need you to look inside my bladder and see what the hell is bleeding. What should he do to settle down the pain? I would be drinking water. For sure, because the challenge with blood clots is that they can accumulate in the bladder and eventually potentially even block his ability to urinate. And if it gets to the point where he cannot pee, that's an immediate emergency room visit. So immediate emergency room. I would try to keep the urine fairly dilute. We want to try to keep things calm. He should be following the diet and he needs to be asking for help. They need to assess for infection, and we got to figure this out. Cindy says, I cannot hear if someone can help. What? Okay. And you guys, if there's ever an issue with the sound, let me know, because it's all about the microphone here. I know IC can go into remission, but how often does it come back? I've been in remission for 3 years, no meds. Now you're hurting again. Yeah, your spell checker is making it challenging, Cindy. Your spell checker is changing your words. Well, listen, if you're icy, remember, we really think of icy more as injury or trauma, and injury happens. So whether it's from chemotherapy or you drinking too much soda or you falling or whatever, your injury can heal and then bam, you hurt yourself again. Denise said you had a bad fall after colon cancer chemo. Oh, hon, I am so sorry. So Cindy, whenever somebody's having a flare, we always want to try to figure out what kind of flare you're having. Is it a bladder wall flare or is it a pelvic floor flare? If you have pain as your bladder's filling with urine that is relieved by urination, that points us to your bladder wall. If you have pain after you're done peeing, that points us more to your pelvic floor. I got to drink water, guys, because this dry mouth is killing this. Hold on a sec. I'll be right back. I got to get my dry mouth gel. Otherwise, this hole's going to hurt. am back. I am back. I am back. I am back with my Biotine dry mouth gel for anybody taking Elavil, an antidepressant, an antihistamine, any other medications that give you dry mouth. You would either ideally do a dry mouth gum, of which I have 3 or 4 of these a day right now, or a gel. And let me just do a little bit of gel here because I got to cover up that. Okay, that'll help. Okay. All right. So, Cindy, pain as the bladder fills with urine that is relieved by urination points us to the bladder wall. Pain after urination points us to your pelvic floor. And so it'd be very interesting to know what kind of symptom you're having. T. Curley says, you went to the hospital. Hold on a sec. You went to the hospital, they sent you home, said nothing was wrong 4 days ago. Denise says, my pelvic floor physical therapist refused to do an internal examination because of your chronic infections. Well, I don't know what to say about that. Cindy up on Facebook says, how do we test for fungal infections with next generation urine testing? Next generation urine testing, bladderhealth.org, you can go learn all about it. Next generation urine testing will identify any and all fungal infections that you might have. Bladderhealth.org. All right, let's go. All right, Facebook, I'm coming back up to you now. Here, hold on. Denise says, hope you don't have dry socket. No, I don't have dry socket. I freaked. I thought I did. The pain was terrible at first. But no, I could see it. I could see the socket in. I could see the blood clot in there. It's now, I'm now 10 days post-surgery. All right. Facebook, my friends on Facebook. Uh-oh. Ooh. Oh, God, that scared me. I thought my computer was freezing. All right. Aaron says, I have Epstein-Barr virus. What can I do to help cure it? You've got to follow your Epstein-Barr protocol. Cindy says she dropped sugar. Now you have zero pain. You think your issues were yeast related. I think that is an absolutely fascinating and wise decision. What sugar feeds fungus? Sugar feeds candida. If the sugar has made your symptoms go away, that's a very, very good sign. Kathleen says you cannot find spring water in any store. What are your options? You just got to do the best you can with what you've got while we're going through this crisis, because right now everybody is being crazy. Guys, somebody says, bring the microphone up. Testing 1, 2, 3, testing 1, 2, 3. That's about the best I can do, my friends. Is that okay? That sound okay? Let me know. Hi, Christina. Somebody says get a water filter like Brita. The problem with Brita water filters is that they're often too good and they take out the pH balancing minerals. And sometimes Brita water filters will produce acid water, and acid water can be irritating. So we actually don't recommend Brita water filters. Hello, Gigi. Hi, Kathy. Hi, Karen. Hey, Karen. Bladder normal, probably not IC. Bullshit. Pardon my French. No, what that means is that your bladder wall itself is healthy. Now we have to look at muscles and nerves, because if the nerves in your bladder are screwed up, then that also could cause frequency urgency. Somebody said charcoal filters are irritating to the bladders. I've never heard that, hun. I actually use a charcoal toothpaste right now. It's black. It's supposed to be better at whitening your teeth. You see, I got a chip right there. Darn it. Hi, Sherry. Hi, Ruth. My chair is so funny. Hello, Dale. Hi, Sue. Jean says, I do respect you, but in the UK at the moment, there's quite a thing going on about IC and embedded infection. One specialist says 80% of his patients actually have embedded infection. He's using broth urine tests, so that's awfully a lot of people being misdiagnosed. Jean, you're talking about what's his name? Uh, Dr. James Malone Lee. Here's the deal. I have a problem with anybody making all or nothing statements. You cannot make an all or nothing statement about pelvic pain. You cannot do it. And I say that, I mean, listen, he's a doctor. I'm a support group leader. He's worked with thousands of patients. I will tell you that through the IC network, we work with 100,000 patients a month minimum. So we have seen, millions of patients over the years. And for anybody to say that every patient has infection or even 80% have infection is just really absurd. Now, and I think the other thing that's challenging is number one, do I think that there's a population of patients who do have embedded infection? Yeah, I do. Not everybody, but I think that's I don't have my best guess would be maybe 10%, 5%, 5 to 10% of the patient population might have embedded infection. But the question is, what type of infection? What type of infection? Because it's the National Institutes of Health funded MAP Research Network. They're the ones who found fungus. And the challenge with Dr. Malone Lee is that I don't think he's assessing for fungal infections. And now we have other research studies in Europe that are finding viral infections in patients with Hunner's lesions. And so imagine if this patient has a fungal infection and you assume that they're a bacterial infection and then bam, you put them on antibiotics, all that's going to do is make a fungal infection much, much, much worse, right? So we at least have to have good diagnostic testing, like a next generation urine test, because a next generation urine test will look for bacteria, but it will also look for fungi. And even if you order the more aggressive one, it will even look for viruses. So I know that, you know, we have had over the years a lot of kind of all or nothing fads. Well, it's this for everybody or it's that for everybody. And the reality is that this population is really diverse and that every single patient is an anatomical mystery to be solved. You are a mystery to be solved. And when you look at the top pelvic pain doctors in the United States, they're seeing muscle issues far more than bacterial issues. And at least in the diagnostic workup, we should have a proper pelvic floor assessment, and let's make sure that muscles are not involved to some degree. I was going to say, so let me do my first product reveal. My first product reveal is our next magazine of the IC Optimist. In fact, they're all sitting out in my car right now because we're also dealing with lots of issues here. And so I hope to get them to the Postal Service tomorrow. And so in this latest issue of the IC Optimist magazine, we have an interview with Dr. Jerome Weiss, the guy who wrote this book. And he's quite older now. I held this for a couple of weeks because I wanted to get an interview with him. But he's dealing with his wife is very ill and he's struggling too. Our feature story in this magazine from Stacy Shannon is, could mold toxicity cause IC symptoms? There's a lot of stuff you got to rule out. And last year was so interesting. I had an IC patient call us who she had pretty severe IC, and her family was also becoming quite ill. Lots of different things going on. And what they found was a massive black mold infection underneath her carpet. It turned out a water heater the previous year or two had leaked or had a slow leak into the carpet. And there was this massive black mold infection in her house. And when they finally found it, they had to move out for a couple of months, get everything fixed. And when they moved out and got away from the black mold, this IC patient's IC symptoms disappeared completely. And she called me up. She goes, "You're not going to believe this. My IC was caused by black mold." And I was like, "Okay, that was a new one on me." And so I gave Stacy Shannon a writing assignment. I said, "I want you to dive into black mold and see what you can find." And guess what? Urinary frequency is a symptom of black mold. So anyway, in this magazine, we have an extensive article on mold toxicity and how molds can trigger some of the symptoms that we associate with IC. And ironically, on Friday, 2 days ago, I had a patient that I talked with last year who called me back and said, "Jill, you were right. We found black mold, and when we treated it, my symptoms went away." So that's something. So that's two patients now. And that's, remember, we're all about understanding the diversity, right? And so, again, I'm not going to make a blanket statement that everybody has black mold. I have no black mold in my house for sure, 100%. But for some people, it is. So, anyway, I've got a really big article on black mold. And so, what are some of the symptoms of mold toxicity? Fatigue, weakness, aches, muscle cramps, unusual pain, ice pick pain, headache, light sensitivity, red eyes, blurred vision, tearing, sinus problems, cough, shortness of breath, abdominal pain, diarrhea, yada, yada, yada. Along with, hello, urinary frequency. Go figure. I've got an article in here on the highs and lows of 2019. What did we learn? What lessons did we learn, both good and bad? But getting back to mold here, um, it's a very geeky issue, guys. I just want you to know, man, this is a very scientific issue, not normally so geeky in these magazines, but in this one I was. So hold on a sec. I got to find this one. Okay, here you go. So again, the MAP Research Network, the multidisciplinary approach to the study of pelvic pain, we summarized all their research from 2019. So exactly a year ago, they published their first study looking at the microbiota of IC patients, bacteria, fungi, and viruses in the urine of female patients compared to controls. Overall, it wasn't that different. However, IC patients did have more Lactobacillus gasseri and less Corynebacteria, whatever, I don't know if we really understand that. However, and this is the one that's interesting, just in the next month, they published a study looking at the role of fungi in female IC patients. Researchers collected urine samples from ICers at the beginning of the study and then again at 6 months and 12 months. 13, 13 fungal species were identified um, um, from over 202 patients. Patients with more severe symptoms had greater fungal diversity as well as an increased presence of candida. So again, getting back to Dr. James Malone Lee and the assumption that every patients have chronic bacterial infection, well, the US federal government, National Institutes of Health, would argue that no, we have to look at fungal infection. So anyway, you'll find that study in here. I have a warning on Singulair, Montelukast, which is a medication often prescribed for asthmatics. However, it was suggested to IC patients a couple of years ago who flared during allergy season. They suggested that patients consider using IC patients use Montelukast during allergy season. But now we have a consumer alert about Montelukast causing neuropsychiatric symptoms and including any increase in suicidal ideation. So you kind of need to know that. Great article on comfortable clothes. What can you wear that's professional, that's comfortable? Fatigue fighting foods, a daily approach to surviving, our coffee challenge, etc., etc. So there you go, my friends. So if you like these support group meetings and you want more information and you're not afraid to get your geek on and learn about IC, please come and be a member of the IC Network. You can sign right over on our website, icnetwork.org. It's $25 a year to get this by email. $50 a year to get this by snail mail, but you get a lot of other stuff. There's, you get if you get it by email, you get 4 back issues as well, 4 future issues. If you get the next level, you'll get a total of 12 issues. If you get the level after that, you'll get 5 years worth of magazines as well as a cookbook. So anyway, the IC Optimist magazine is released. If you are an ICN member, log on to your member page. You can download it right now. It is going out in the mail, hopefully tomorrow, to everybody who has it mailed to them. Alrighty, so there you go. Let's go ahead and do our other product reveal. And I do need to take a moment and thank our sponsor. Our sponsor is Preleaf. We want to thank Preleaf for supporting the IC patient community for the last 25 years. Preleaf is the most well-known supplement. It does not do anything for the bladder wall. It's not like a bladder coating, but it can reduce the acid level of foods that you're eating that might irritate your bladder. And so if you have to go to grandma's house and eat her homemade lasagna and you don't want to make her feel bad, take a couple of Preleaf before that. That will help reduce some of the acid load of that food. Of course, this is not candy. You do not eat it all day, every day, because it is calcium. And if you eat too much, you can end up with kidney stones as well as some other issues. So this is just as needed. You guys should know I'm always a less is more kind of person. I don't believe in taking more of everything, of anything. I always believe in trying to take the lowest effective dose rather than the highest effective dose. Now here is our other. I wanted to do this 2 weeks ago, but I had the abscess tooth and I couldn't. A company in England reached out to me and sent me this. Now, many of you know that chocolate is an irritant. Why is chocolate irritating? Because number one, it tends to be a bit more allergenic and can stimulate histamines, and sometimes anyway, chocolate irritates a lot of people. I cannot eat chocolate. If I eat chocolate, I get terrible bowel spasms, and like literally, while that chocolate is in my body, wherever it is, my gut goes bam like that, starting with my stomach all through my small intestine, and by the time it hits my large intestine, holy hell does that hurt. I call them bend over and screamers when I eat chocolate. However, I can eat carob, and it turns out quite a few patients have problems with chocolate, but we tend to do well with carob. So Super Treats is a company in England that has created a new carob product. And I think it's pretty good. So they sent me a small case, and we'll probably give away some of these for freebies, because if they're here, I will eat them. And I'm already kind of fat right now. I kind of gained some weight in the last month. So I'm going to give them away. But anyway, almond hazelnut crunch and silky smooth. So let me just open. Hold on. Okay, I got 4 of each. They are vegan, caffeine-free, no refined sugar, non-GMO, gluten-free, soy-free, with prebiotic inulin. So let's just open one. I just kind of want you to see it. And of course, I'm going to have to eat it. Oh my God. Well, at least with this home confinement with coronavirus out there, I'm not going to go snacking at bakeries. I can't really go anywhere because I got a 91, 97-year-old in the house. So I got to be super careful. All right, look at this. Look at this, my friends. It looks just like chocolate. And this is the Crunch Bar, right? It looks just like Nestle's Crunch. And this is 600 calories in one of these. So this 100 calories. It's really smooth. It's got a great flavor. Man, this is going to satisfy any chocolate cravings anybody has. Oh God. Like the first one I ate the entire bar in like 5 minutes. 600 calories. But if you need a treat, 1 or 2 of these a day might work really well. And they ship to the United States. And if you're in Canada or in Europe, not a problem. And I'm not being paid for this, guys. They just sent them to me and said, "Hey, we hear you like carob." If I didn't like the product, I wouldn't talk about it. But I think, yeah, it's excellent. Oh, I wish I had some kids here I could give this to, so I won't eat it. Mm. You know what the problem with eating sweet things is? You just want to eat more sweet things. Now I have to go get a protein bar to turn off my sweet cravings. All right, let's go back to your questions. It's Aria says, thank you for your videos. Please keep it up. You're welcome. And for your research. You're welcome. I like research. I embrace my geekdom, my nerddom. I think being a nerd is cool. Cindy says, I find it hard to stand and do any activities. I feel like giving up. I feel like I get a Charlie horse all across my front. I've had IC for 30 years and I'm better in some ways, but still can't cook or clean without stopping over and over. So Cindy, what the hell's going on with your pelvic floor? Listen, if movement is triggering your symptoms, what is involved with movement? Muscles. You feel like you have a Charlie horse. So something clearly, Cindy, is going on with your muscles. So what is the pelvic floor, your physical therapist saying about that? Don't give up, my dear. Listen, remember when Dr. Chris Payne released his subtypes, one of the things that he railed upon was patients being told that IC was incurable. When in fact, some subtypes are curable, especially the muscle issues. Muscles respond beautifully to muscle therapy. I'm living proof that muscle therapy works. Now, the other thing, Cindy, I just want to say the other thing that's important to understand is anytime we see a lot of chronic muscle tension, we always want to look at bony structures. Is there something going on anatomically with your skeleton? Like, do you have a bad SI joint? Do you have a bad hip? Do you have a bad knee? Do you have a bad foot? Something that could be biomechanically influencing your pelvic floor muscles and keeping them chronically tight and dysfunctional. We have to look at that too. And so, Cindy, of anybody, the book you girl, seriously, you need to read this book, and it's free on Kindle Unlimited, or it's $9 on Kindle on Amazon. You can get it from us for $29, and I will probably be giving 2 away at the end of this meeting, like I've done for the last month for more people. So Molly says, I had a hysterectomy 4 years ago and have been in pain ever since. Girl, I think we've talked about that, right? So you are potentially a surgical injury patient, and we've got to figure out what happened during that hysterectomy. Or do you have involuntary muscle spasms, levator anispasms after your hysterectomy, like I did after mine for 10 months? Brutal. Felt like there was a fist up my vagina grabbing my viscera and pulling downwards. It was an awful, awful feeling. And as soon as I get even a slight pulling sensation, I know it's time for me to whip out my glass wand and work on those muscles. If you have pelvic floor dysfunction and you're working with a physical therapist, they're probably also going to have you be doing work at home. And number one, getting to the physical therapist is difficult. Number two, it can be expensive. But number three, ultimately, in the end, it's our responsibility to know our body, right? I mean, we want to empower you so that you can do what you need to do at home without depending potentially on a doctor. And this is where you might need to use a glass wand internally, vaginally, or for guys rectally, to try to find those muscles, the muscle that's the problem. And clearly, I have pain on the inside of my right hip bone and the inside of my left hip bone, which tells me my pelvic floor is getting tight again. Doesn't surprise me. So I'm going to have to do this tonight. I should do it right now, but I'm doing a support group meeting. And no, I will not do it live. Cheryl says, so nerves can damage the bladder wall? Absolutely, nerves can damage the bladder wall. An irritated nerve is going to release something called substance P, and substance P damages tissue. It's what makes, think about somebody who has a like shingles, for lack of a better term. When you've got shingles, yes, you've got a viral infection, but that nerve is super irritated. And what happens with shingles is everything gets very, very red and inflamed. That is the nerves releasing something called substance P. And then, of course, once you've got substance P in that tissue, any mast cells in that tissue are going to release histamine, which is going to irritate the nerves more. So you get stuck in this vicious cycle of neuroinflammation, or neuro irritation might be a better way to look at it. And so, yeah, that's called a somatovisceral reflex. And this book, Breaking Through Chronic Pelvic Pain, explains it all. But we knew that. I mean, I remember talking to Dr. Theo Arides like 20 years ago. He was in a lecture on our website, and he talked about that 20 years ago, that sometimes the bladder wall can break down from an internal process. Sue says, what is the percentage of IC individuals that have backache and IC at the same time? I don't know. I don't know. Marge says, I have low back pain all the time, especially after sleeping all night. I may end up sleeping 4 to 5 hours in bed and I end up on the couch. Low back pain is a lesser known symptom of chronic pelvic pain, and the general assumption here is that it's because you've got back muscles that descend deep into the pelvis. And so if the pelvic floor muscles are going to get tight, then the back muscles, the psoas muscles, are also going to get tight. Hey guys, it's time for a bathroom break. 30 seconds. Let's see who's the fastest. I'll be right back. Alrighty then. Sorry. Hey man, you got to do what you got to do. The cool thing about doing support group meetings online is you can get up and go and nobody knows you've gone, except for me. Ruth says, anything that goes inside of you triggers you. Well, okay, but hun, that makes total sense, right? Because you've got tight muscles. And so if you avoid it and you don't do anything, the muscles are just going to get tighter and tighter and tighter. You got to do something about it. And so you may have something that's called vaginismus. You may have had tight muscles for decades. And sometimes it can even, I mean, I was working with somebody. Oh God, it must have been like 2 months ago. And it was a guy, as a matter of fact, and his pelvic floor muscles, he was in his 50s, were just as hard as a rock. The poor guy. And it turned out that when he was young, his mother demanded that he have a bowel movement before he go to school every day. And if he could not have a bowel movement, she gave him an enema. And you can imagine what that did to his pelvic floor, as well as just fear contracting those pelvic floor muscles. And so he has been on a years long journey to try to repair the damage that his mother forced on him for many years of his childhood. I mean, she was fucked up. I'm sorry for saying that, but you know what? I'm sorry. I swear. I do. I do. I just do. Listen, this is a crazy world right now. We've had fires. Now we have a pandemic. You are entitled to get angry and swear every now and then. But when I think about the torture that she put on her son through, it infuriates me. And that was so wrong. And here he is in his 50s now, still dealing with terrible, terrible pelvic floor problems that go all the way back to what she did to him as a child. Shirley says, I've had acupuncture on my abdomen with massage. All right. Denise says, my physical therapist has determined the scar tissue from your C-section is a big contributor. We see that a lot. And in fact, in another book called Ending Female Pelvic Pain and also Ending Male Pelvic Pain, there's a whole section on working with scar tissue and scar rolling and doing things like that. And so, yes. Cheryl says, can we do muscle work at home? Absolutely. You absolutely can. Cheryl says magnesium seems to help your bladder. Okay. That's we don't normally see that. It might be giving you a little bit of muscle relaxation, but you guys don't go out and start doing a lot of magnesium because you get the runs. Shirley says, I had to have your C-section scar removed. You actually had two, as during the second C-section, your first scar was never removed. Oh, holy hell, girl. Marge says she takes magnesium daily and it helps. Okay. Power to you. Kristen says, I know I most likely need pelvic floor physical therapy, right? But right now I can't afford it. My insurance barely covers any of it, but I'm anxious about it having someone touch me there. I hate massages as well, and I think it's because of past physical abuse. Is there any different way to relax tight pelvic floor muscles? So, Kristen, girl, listen, you are so not alone. You are so not alone. And I number one, I'm so sorry that you were hurt, and your discomfort in having anybody work with you is normal. It's logical. It absolutely makes sense. And any good physical therapist would ask any patient about that first. And you've got to be willing to tell them. Now, there are some patients whose muscles are so tight they cannot do any internal work anyway. But if you're uncomfortable being examined or touched down there, let them know, because what they can do is they can start externally. They can look at your legs, they can look at your back, they can look at your core, they can look for unusual muscle tension patterns. And again, this book, Breaking Through Chronic Pelvic Pain, in my opinion, would be absolutely perfect for you, because it will give you a master class in your anatomy so that you know the right questions to ask, right? And it will kind of help connect the dots as to why, if you experience one thing, then you're going to do something else to counter. God, I'm not saying that well. I'm just telling you, the book will empower you in this process. And any good physical therapist will go incredibly slowly and only as far as you're comfortable going. They might also be able to teach you how to use that wand as they would normally do anyway, so that you can build some confidence. If for children who, and I don't know your circumstance, so I'm not commenting about you uniquely or specifically, but for any child who was sexually abused, we're going to see a lot of chronic tension as a guarding reflex. And it's going to be a challenge to let some of that tension go. But it can happen incrementally, and sometimes you start with the feet and work your way up. Also, they're going to teach you how to do guided relaxation. We've got some free guided relaxation resources where if you can just learn how to relax your muscles kind of thoroughly, if you can do that once or twice a day to do a whole body relaxation, that would be absolutely fantastic. And hopefully you will gain confidence and trust in the person you're working with so that they can start to try to understand what's happening with you, and letting them do a very, very preliminary examination, just very slowly, stop whenever you need them to stop, would be fantastic. The pelvic floor is confined inside of your pelvic muscles. There's no really easy way to reach them from the outside. The best way to reach them in a woman is vaginally. And so it would be great if you could get confidence in them, confidence in yourself, go slowly and see if you can get there. And in the meantime, I hope that at some point in time you've worked with a victims group and that will help you deal with any other issues that might be going on. It's real. I was rescued from a rapist when I was 19. I was rescued. And so I was found before when I was at Choate Prep School teaching tennis one summer. And a guy, I was young and not particularly smart about guys because I was kind of geeky and nerdy, and took me up to the attic, and before I knew it, I was halfway naked and saying, "Stop, stop, stop." And thankfully another staffer came in and stopped him. So I get it. Liz says, "My IC calmed down during my period. During my period, I'm wondering hormones play a part." Absolutely. We see that. There's definitely a small subset of patients whose symptoms are being driven by swings in hormones. And in some cases, birth control pills make it better. And in other cases, birth control pills make it worse. And again, you are an anatomical mystery to be solved. It would be very interesting to work with a gynecologist, maybe have some baseline hormone testing just to see if anything weird's going on. Sue says, "I hope you're feeling better." Thank you. We're getting there slowly but surely. Oh, honey. Oh, so you're having your breast cancer surgery on April 20th. Is there any chance the anesthesia will bring on a flare? Probably not. I don't think you need to worry about that, hun. And listen, you're going to be, even if it did, you're going to be on pain meds for your breast cancer surgery, and you're not going to feel it. Fawad says, "May everybody heal soon." Thank you. Thank you. Not just from IC, but from everything that's happening right now. Suzanne said, "My pain is bladder wall driven. Chamomile tea absolutely soothes the bladder wall for me." Awesome, girl. Love to hear it. Monica says, "Most of the time my pain's after urination, but sometimes it's just out of nowhere. And sometimes it's after I eat something I shouldn't. Could I have more than one causing pain?" Yeah, absolutely. Absolutely. You can have a bladder wall flare. This is really one of the things that I found most odd when I was first diagnosed with it, is that I back then, because my bladder wall was a mess, I was very, very food sensitive back then, but I also flared after sex or after a long car ride. Okay, why? Because sex and a long car ride irritate the pelvic floor. So you can have a bladder wall flare or you can have a pelvic floor flare. They're all possible. And the secret, here is to make sure that you're not wasting. I mean, if you have a flare from sex, then your therapeutic priority is to relax muscles. So you're going to be doing muscle work. You're going to be taking a hot shower, hot bath. You're going to be using heating pads. You're going to be using maybe vaginal Valium or an oral muscle relaxant. Whereas if you have a flare that's coming because you had coffee, your strategy is going to be very different. Your strategy number one is going to be to dilute your urine to try to dilute out any of the irritating acid. It's going to be to calm and soothe your bladder, which the chamomile tea would do. And maybe you would do some bladder calming therapies. If it was a really, really severe bladder wall flare, you might even do a rescue installation. But if it's a moderate flare, maybe you can get away with a little bit of azo and a little bit of Mirvatric. But, guys, if you go sign up for the IC Network free newsletter, you will get our 40-page flare management guide to download. And it gives you hour by hour rescue plans. Ugh, my mouth is dry. Sue says she's bad. You're eating a fritter now. Now, guys, let's talk about. We got to talk about this for a moment. There are times when life is so chaotic that you need a little bit of comfort. And I'm a perfect example of that. I eat ice cream once a year. I can't remember the last time I had ice cream. I probably 5 years ago. And yet after this surgery, I needed something soothing and cool. And I, over a period of a week, ate a gallon of ice cream, which would explain why I probably gained 5 pounds. But I was thinking about that this morning. There are moments when it's okay to reward yourself. And if eating a fritter makes you feel good right now, girl, nobody's gonna hold you to it because you're in a fight right now. It's okay. We just don't want you to do it every day. Right? You gotta eat healthy because we need you as strong as we can because we want you to get through that cancer surgery, right, Sue? But if you want to have a fritter, you go for it. I had 2 cinnamon rolls the other day because I'm a little stressed right now because again, we got corona. We just had another case of coronavirus found in my county. And I got a 91, 97-year-old person. I live in fear of bringing something home that could kill them. So I haven't left my house in 3 days because I don't want to bring something home to them. What is that? Somebody said something about obturator. Did you know they now use a scope to do a lithotripsy instead of having it put up against your side? Has anyone had that procedure done? I have 10 stones and surgery to get this done. Ooh, girl, man, I hope that surgery goes well for you. Holy moly. Oh, Jean says it's not Professor Maloney, it's another one. Interesting. Okay. Mandy says you have ESBLNs and have had it for 2 years. It's embedded in the stones in all of your kidneys. Yeah. Kidney stones are really interesting because, I guess when you think about a stone, you think of a pebble, right? You think of a smooth surface. And it turns out that kidney stones are actually crystalline and they have sharp crystalline edges all around them. And that's why when you're passing a kidney stone, it hurts so much because those sharp edges are cutting your tissue in your ureters, in your bladder, and in your urethra. But the other thing we learned about kidney stones a couple years ago is that they're covered with bacteria. They're just like bacteria factories. And so, Mandy, I'm not at all surprised that you've got that. I'm so sorry, and let's hope we can get those stones. And if they are calcium oxalate kidney stones, then pre-leaf is not something you should be using, right? You shouldn't be using supplements that have calcium or foods that are high in oxalates. But you'll get through this, girl. You'll get through this. And Sue, I'm looking at you, Sue. Actually, I'm looking at you up here right now. Sue, we got your back. You're going to get through this. You've done it before. You're going to do it again. You are the warrior princess. Xena Warrior Princess. Only you're going to be the warrior princess against breast cancer right now. And I believe in you. Never ever doubt your strength. You have never been more prepared to deal with whatever happens to you than you are at this moment, because you are truly one day older, one day wiser, one day smarter. You can do this. What's the right word now? We're doing this. Is this what we do now? If we see somebody and we can't shake hands, we're going to do an elbow bump, or we're going to do this. But this kind of means, love and appreciation. Gigi, when we're under stress with all that's going on right now, we have a tendency to eat things that we normally don't do well with, so no more peanut butter for me. I've been eating peanut butter on rice cakes. I do almond butter. I don't do peanut butter. I do organic almond butter, and I can get away with that. Gary says, hi, I'm here for the fridge. Nancy says, nice to see you. Love the white hot cocoa. Oh, good. I was criticized for suggesting it by an uncool gal on Facebook. I know it has sugar, but it's so good and it's soothing. Appreciate your hard work. Everybody's different. Everybody's different. Hello, Catherine Lewis. Kristen says, I do believe I have bladder and pelvic floor issues. I react big time to coffee, wine, anything citrus, plus stress and certain activities make me flare, even sitting down in an uncomfortable chair and standing up. Okay, so we know the coffee is your bladder wall. The chair is your pelvic floor. I also have hip pain from standing, as well as numbness in my left thigh. Girl. Okay, so that numbness in your left thigh is that a nerve is being compressed by tight muscles. Kristen, seriously, there's a whole chapter in this book that talks about that. You've got to get this book. There's no mystery here. I have that issue every now and then too. I mean, take my word for it, Kristen. Breaking through chronic pelvic pain, please get it. And you're going to have your socks knocked off, and it's going to explain all of your symptoms. Oh, Kristen said, I tried pre-leaf last night with some delicious rigatoni, and it helped good. Pam says she doesn't leave home without pre-leaf. Awesome. Somebody wants freebies. Oh, Suzanne says you got the 12-bar box. Carob is an acquired taste for me. I'm a chocolate snob, but it is satisfying your cravings. A little pricey though, but you have to have your chocolate. Yeah, it might be a little pricey. We also sell Yes You Candy Carob in the IC Network shop. And so these are smaller pieces that are much, much more affordable. But we can't ship them during the summer, so they're only available in the fall, winter, and spring. And once it gets warm, we have to stop selling them. So if you guys like carob, you can get it in our shop too. Hello, Patricia. Angie says, are you still planning to do prolotherapy? I'm really interested in how it goes. Yes, but they've canceled all non-essential procedures at my local hospital, so I probably won't be able to do it for 6 months. At this point in time, the hospitals out here are basically canceling all non-elective procedures, non-emergency procedures. So it is what it is, and I'm really very, very I don't want to expose myself, which could, I mean, if it were me alone, I'd be fine. I'd be willing to go for it. Although, granted, I'm very careful during flu season anyway. But I just can't risk stuff with a 97-year-old and a 91-year-old in the house. I got to tell you a story, guys. Okay. Actually, I have 2 stories. So, so when they brought the cruise ship people from Japan over to Northern California, they put them at Travis Air Force Base an hour from my house. And we had our first community acquired case of coronavirus in that town, Vacaville, within a week, right? And so I have coronavirus to the east, I have coronavirus to the south, immediate south, and to the west. So it's kind of like fire season. Can I go this way? It's crazy. I told the only time my mother leaves the house is because she has trouble walking, is to get her hair done on Fridays. And I've been telling her for a couple of weeks. I said, now listen, if anybody gets sick at the hair salon, you can't go. I'm not taking you. And she's like, but I really want to do. And it's like, I know you really want to do it, but I'm not taking you if anybody's sick. So I will call them ahead of time and let's just make sure everybody's healthy. Um, and so Saturday or Friday morning, I was getting ready to call when her hairdresser called me with a terrible cough. Terrible. She sounded terrible on the phone. And she said, out of an abundance of caution, I cannot see your mother. I will see you next week. And I said, no, you will not see us next week until you have a negative test. Right. So then my mother had an appointment yesterday at the same place. And I called that employee and I said, listen, I'm not bringing my mom in until we know that this employee does not have coronavirus. And of course, the second employee I was talking with had no idea. And I said, you guys better have a plan. You better have a plan. You work with elderly people. If one of you is sick, you really need to shut doors for 2 weeks, or at least until she's tested to make sure you're not infecting everybody, right? They called me back furious. How dare you suggest that we do that? It's like, we don't think it's a coronavirus. We think it's her anemia. And what I said is, you're guessing. You're guessing. And that's not good enough. And until you have the facts, you should not be seeing people. And do you know they're open today? And I'm furious. I will not take my mom there for at least a month. The second interesting story is somebody I watch on Twitch who was in LA and shook the hands of a teenager who shook the hand. He's a gamer and I like watching games. He shook the hands of one of the professional NBA players that tested positive for coronavirus, flies home, sick as a dog at home, gets better, then gets sick again, right? And he couldn't do a tournament today because his dad is insisting that he go get tested because they will not let his dad go to his job until we know that his son does not have coronavirus. And the son is furious. It's like, I don't need to be tested. I don't have it. It's like, yeah, you damn well need to have it. So anyway, that's enough. I won't say anything else. And so now if we were taking a shot every time I said virus, we would have had 6 or 7 shots so far. So you can have a shot of water, okay? Not alcohol. It's gonna hurt your bladder. Water. This is serious. Where do you get the glass wand? We sell the glass wand in the IC Network shop. Molly says you can't afford pelvic floor physio. It's 140 for the initial assessment. Well, just try to save your money until you can do it. You don't have to do, if you can just go once so they can tell you which muscle is a problem, that's the goal. Liz says, I've seen some say they flare when they are on their period. I had the opposite. I felt some relief during those days. I'm wondering if hormones play a role in helping calm things down. I'm taking pelvic floor therapy and it has helped, but it still had the urgency. Tolterodine was given to curb the symptoms, but can also cause retention. I'm stumped. Well, again, remember that some people, there are some people who flare when their estrogen is high, and there are some people who flare when their estrogen is low, and that explains why it changes. That's why their flares, they're so different with their flares. I used to flare the day that I ovulated and a couple days before my period, but once my period started, I always felt better. But there are some patients who, once their period started, they feel worse. And it's just funky, we're all different. We have different responses. You still have the urgency. So urgency can come from tight muscles. So if you've got tight urethral diaphragm muscles, that would explain the urgency. If the God, can I talk? No, because I have freaking dry mouth. Tolterodine, does that help? And guys, for people who've come in, I'm recovering from oral surgery 10 days ago. Hello, Robin. Hello, Charlene. Pamela, I developed IC after hysterectomy and have nerve traps and scar tissue. Girl, There you go. Perfect example. I see subtype 3. I have both wands and they do help. Even in small amounts of relief is worth it. Han, I'm so sorry. I am so sorry. Have they and it's so hard because once you have scar tissue, if you go in and surgically remove the scar tissue, then you're going to have scar tissue from the second one. But there are moments when sometimes they have to do that. But I think it's absolutely fantastic that the wands are helping. And so for you, Hun, what might be interesting, and he makes a case for this in here. I mean, I think that you would really benefit from the chapter in here on treatment strategies for pudendal nerve entrapment. A non-surgical strategy for treating PNE for PNE pain. This chapter 10 in this book. I think that you would get some benefit from this book, and it will give you at least some other ideas on things that you can potentially approach. And in fact, he tells a story, age 32. Yeah. Okay. Well, there's a lot of patient stories in here, a lot of success stories. Hello, Becky. Hi, Kareem. Angie says scar tissue is a big thing. I had a lot from my ribs down to my hip from smashing your colon flat. My whole left side was covered from the gallbladder surgery. It was removed, and dry needling therapists worked the scar tissue out of all my incision scars. Well done, girl. Well done. Jennifer says, I had Botox in my bladder a week ago. It usually works well for the IC, but I've been miserable every day since the Botox. So, Jennifer, because you had Botox in your bladder wall, that basically meant that they had to go in through your urethra. Anytime you have a procedure that involves pushing something into the your urethra, that you do run the risk of picking up a bladder infection. I have to wonder if you have what we call a nosocomial bladder infection, an infection that comes from a medical setting. And you need to call your doctor and let them know that you are doing terrible after the Botox. They need to rule out that they might have given you an infection. Sue, I apologize if I mixed up you and Molly. I apologize. It's just been crazy. Brenda says, I've gotten a lot of relief from Peora for your bladder, and it has helped me get off of opioids, but I'm still having a lot of pelvic flares that are still keeping me down. I'm going to see a gyno this month at Stanford, and I'm so afraid of being sent home with little help again. Any thoughts or advice, Jill, before I go to see them? So again, Brenda, your goal here is to not walk in and say you have IC. You need to walk in and say that your pelvis is on fire and you don't know why. You want to get them focused on your anatomy, right? So please don't say you got IC. Please go in and describe your pelvic symptoms and say you're here because you want them to study your anatomy. Is it your muscles? Is it your nerves? Is it your bones? Whatever. We need a fresh look at your pelvic category. And again, Brenda, if you don't have this book, girl, you need this book, because if you read it, you will be able to walk into that appointment really knowledgeable, and you'll be able to say, could you please check my piriformis muscle? Could you check my obturator muscle? Could you check my levator muscle? Let's just make sure none of these are doing it. And then, of course, we're also going to look at other things that have the potential of triggering your pelvis. Could you have a fibroid tumor? Could you have endometriosis? Is there something else structurally, physically going on in your pelvis that could be triggering some of this pelvic pain? It's not all your bladder. We have to look outside of your bladder also. And you need to tell them that you're living in bed. You need to tell them that it's so bad that you really can barely get out of bed, that walking hurts. If walking hurts, that points to muscles. If you have electrical pain, if you have positional pain, if you've got vibration, if you've got, we call them fasciculations, kind of a fluttering feeling, if you've got numbness on your skin, then that points to nerves that are being probably compressed by muscles. And again, this book explains it all. Get it, read it, it will help you. I said when I did the book review, for this. This is the best book ever written for IC and pelvic pain. Best book in 50 years by far. It is a masterclass in the pelvis. Masterclass. It helps you understand why Western medicine fails, because in Western medicine, specialists never look outside their unique box. Urologists look at the bladder and the prostate and the kidneys and the urethra. Gynecologists look at the uterus and the vagina and the ovaries and the fallopian tubes. Gastroenterologists look at the bowel. And what he argues in this book so successfully is that you can't do that in the pelvis because everything is so interconnected. We have a somatovisceral reflex and we have a viscerosomatoid reflex where pain anywhere is going to cause your muscles to get dysfunctional, and a muscle injury can affect your bladder and can affect your vulva and other things like that. Joan says she's back at physical therapy. If physical therapist was impressed, you knew the obturator was pressing on your pudendal nerve. Asked me to listen to Total Body Relaxation by Nari Clemens. I would recommend listening to that. Hey, thank you for that reminder. Let me write that down. Hold on. Oh, I love recommendations like that. What the heck is this? Don't you hate it when you do a Post-it and you don't remember why? That would be me. All right, so hold on a sec. So that is Total Body Relaxation. By Nari Clemens. All right, I'll put that on my list. Molly, I'm sorry. Diana, that if you have tight muscles or compressing nerves, and the way that Dr. Weiss assesses for nerve involvement, one of the things he looks for is numbness of the skin above the compromised nerve. And so if you had numbness on your perineum, on your vulva, around your rectum, or even in your legs, in your hips, in your legs, in your back, that points directly to a nerve that is being compromised, usually by tight pelvic floor muscles. Libby, absolutely. You can give me a phone call tomorrow. What's the book? The book is Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. And I will be giving 2 of these away along with some Cara bars when we're done. I'm not going to be able to go 4 or 5 hours today, guys. I'm still recovering. Ruth says, I have a diverticulum of the urethra removed by vaginal entry. Trauma? Well, yeah, of course. I mean, that's always going to be trauma. But the fact that you had a diverticulum in the first place, tells us that diverticulums in essence will cause pain either directly or because they collect urine. The odds are you might have had a bladder infection or a bacterial infection or a fungal infection inside that diverticulum that would have also caused pain and discomfort. And so your pelvic floor muscles could have been tight just from the symptoms that the diverticulum was causing, not just the surgery. But you had to have the surgery. It is what it is. And the cool thing is that, you know, the incision should be, I would assume, quite small. And because it is, in the vagina, you might be able to do some massage of that that scar tissue, if that scar tissue is part of the problem. I mean, you have to talk to your gynecologist and or a physical therapist about it. Okay, why am I cold? Hold on, I got to turn my heater on. Because there's a storm outside. That's why I'm cold. I have a little heater on the floor. Have I read The Body Keeps the Score? No. I do not know. I do not know. All right. All right, guys. Well, hey, man, I'm ready for more questions. If you've got any more questions, please feel free to ask them. Otherwise, what I might do is I might read through some of these success stories in this book, if you don't mind, because they are so important and insightful. Let me go right to the urinary. Anybody listen to music? I'd really love to hear what you guys are doing at home right now if you're staying close to home also. Crazy times. Libby says you need that book if you yeah, and the book is dedicated to muscle and nerve dysfunction. This guy is probably the national expert on pudendal nerve injuries and pudendal nerve issues. I need that book if he talks about PN. I've had multiple blocks now. The problem is too complex because that lady fell on my head. Yeah. I don't remember exactly what happened to you, Libby. I'm sorry. John Lee, having pain irritation when using compounded estradiol cream. Any ideas? So is it getting better? So if you're super, 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 super dry, you got to understand your skin has no natural defenses at that moment because there's no protective coating or very little protective coating. So anything you put on that dry skin on your vulva is probably going to be uncomfortable. But so the first time you start using an estrogen cream, it's going to feel very hot and it's probably going to burn like heck for 5, 10, 15, 20, 30 minutes. But every subsequent time you use it, that heat should get better and better and better because your body is now using some of that estrogen to produce mucus. So for me, it took about 2 weeks before the heat went away. And now when I use my estrogen cream, it's like a little puff of warm air that's gone in seconds. And so if you're seeing that burning pain improve slowly over time, that means that your body's starting to do it. But the only caveat here is that if you're using Premarin, the preservatives in the Premarin are really, really, really well known to cause a lot of unnecessary burning. But you're using a compounded cream, so you're not using the Premarin. And so the question is maybe the compounded base they've given you is a problem. So you can ask them to put it in olive oil instead or some sort of oil rather than the cream. But they should work with you to try to figure out what it was in that cream that's bugging you. Joan says she loves to listen to Reiki meditation on Pandora. Nice. Libby says she just doesn't want to know what to do about your PNE anymore. Libby, girl, I'm telling you, best book ever written on PNE. It'll explain it all, but you can't jump forward to the PNE chapter. You got to start with the anatomy because he's going to show you and teach you exactly where the nerves get compressed and exactly what muscles compress the nerves. He's going to, and then, as you get through that, and when you finally work to the PNE chapter, there's just a ton of stuff that you can do. I mean, it's just a fabulous resource. Monica's, what exactly does birth do to the pelvic floor? That's when my pain started. Well, Number one, it can overstretch muscles, or you can tear muscles. If you have a torn muscle, especially a third degree tear, where there are different variations of tears, intensities of tears, or ratings of tears. So when you get to a third degree tear or worse, you're looking at a really significant muscle damage where that muscle is basically ripped, and they generally will have to suture it back together, and you can end up with a lot of scar tissue down there, a lot of trigger points there that will restrict blood flow to the bladder and restrict blood flow to the vulva and stuff like that. So birth injuries are so common that in most other countries, women who have had babies are sent to pelvic floor physical therapy after they have birth, with 6 weeks, 8 weeks, 3 months after birth, to make sure that their muscles are healthy and not damaged. It is in one area that the United States falls terribly short, that we don't do that, and we should be doing that. Ruth, made from horse urine and contains alcohol. Yikes. That would be Permarin. John, watching Celtic Thunder tonight. Awesome. Awesome. I love Celtic music. Karen says, my compounded estradiol cream is made with Avo jelly. There you go. And I also have a separate compounded estradiol product that's made with petroleum jelly that I use for the numbness that I sometimes get on my vulva from my pudendal nerve entrapment. They mix it with estradiol. Yeah, estrase has a lot of extra preservatives in it that can be irritating. Joan says, physical therapy recommended no soap, just water. Then I sat in a hot tub without thinking. Doesn't seem to bother me, and your muscles are better now. Do I stop? No, I don't think so. But I think, hon, you got to understand that hot tubs. Number one, hopefully it's your hot tub and not like a community hot tub where other people are sitting in it. How that hot tub is maintained, chemicals is important. I've worked with patients who've developed a quote unquote IC after getting a brand new hot tub where they just put the chemicals on it and they didn't wait for 24 hours for the chemicals to gas off before they sat in it, and they got a chemical burn. So as long as you're doing okay, and I would just recommend that you take a shower afterwards just to wash the chemicals off of your skin, off of your vulva, that would be, I don't have a problem with you doing that. I would love to have a hot tub. I would just be super, 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 super careful with the chemicals and how they're done. All right. So hold on a sec. I don't know where my working copy of this book is, where I have it all. So I want to tell a couple of, let's go through a couple of IC pudendal nerve patient stories, okay? Actually, I just want to read this section on the pudendal nerve here and urinary symptoms. Actually, hold on. Let's just do this one first. This is Sarah's story. Sarah came to me at the age of 24 with a 1-year history of urgency frequency. She had been passing small volumes of urine 12 times a day on average. There was also a delay when she tried to start her urinary flow, and once initiated, it was very weak. Sarah also mentioned that she had pain during deep penetration with intercourse, but the pain subsided if she held still and waited for a short time. And for the past 3 months, she'd been experiencing suprapubic pain, pain above the pubic bone, in bed at night. These symptoms began within 24 hours after an intense orgasm during a period in which she was under a lot of emotional stress and was holding her urine back for long periods of time. In spite of negative urine cultures, Sarah had been treated with 2 courses of antibiotics, and not surprisingly, this failed to resolve her symptoms. A cystoscopy to evaluate the bladder and the urethra were then performed and showed no abnormalities. However, the procedure itself gave her excruciating pain. My examination revealed trigger points in the adductor muscles of the inner thigh, the rectus abdominis muscles above the pubis, the piriformis muscles, also known as the hip rotators, and the quadratus lumborum muscles, which attach to the lower ribs and the top of the pelvis. The internal muscles of the pelvic floor, especially around the urethra and urethral sphincter, were also markedly tender and duplicated her symptoms when compressed. This indicated the presence of trigger points there as well. Treatment consisted of internal myofascial release for the pelvic floor trigger points and dry needling of the trigger points in the external muscles. The internal and external trigger points and secondary muscle tension quickly resolved. Within 1 month, intercourse and orgasms were more pleasurable, and daytime urinary frequency decreased 12 to 15 from 12 to 15 times to 8 to 9 times. And after 3 months and 15 office visits, voiding had stabilized at an average frequency of 7 to 8 times per day. Though slightly higher than norm, this output reflects, right, yada, yada, yada. Sarah's history includes a string of early traumas to the pelvis that could progressively increase the muscle tension in the affected areas. At the age of 7, she slipped on a wooden plank and landed on her vaginal area, resulting in hymenal bleeding. At 16, she was kicked in the crotch, and at another time was punched in the clitoris. This resulting pain was so severe she was unable to walk for a day. At the age of 19, she injured herself and lost consciousness after slipping on the side of a swimming pool. She was a gymnast at an early age, and at nighttime began dancing vigorously. This resulted in pain down her left leg. All right, who was it who said they had pain down the left leg? One of you did, or numbness in your left leg. So this resulted in pain down her left leg and low back, which she attributed to an injury of the sciatic nerve. As one incident after another occurred, trigger points formed. All or most of them appeared to remain latent or asymptomatic. The only indication of a problem was pain down the back of her leg, which could have been from the piriformis muscle compressing the sciatic nerve, or perhaps trigger points referring pain to that area. One day, these tight, strained muscles were put to the ultimate test by a vigorous, prolonged series of contractions from an intense orgasm. Muscles around the urethra and the rest of the pelvic floor went into a sustained, severe, self-perpetuating spasm. The result was urinary urgency, frequency, diminished urinary flow, discomfort around the pubic bone, and pain with intercourse. Sarah's story demonstrates how cumulative stresses and traumas to the pelvis can eventually explode into severe sustained symptoms when a critical threshold is crossed. It also demonstrates that urinary symptoms are more likely to reflect what happens outside of the bladder than inside. Therefore, practitioners are advised to evaluate and treat accordingly. Additionally, and importantly, it illustrates the power of myofascial therapy, which in this case consisted of internal myofascial release and dry needling. No other therapy was required. Perhaps the most important take-home lesson relates to the rapidity of Sarah's recovery. She was only 23 years old when her symptoms were activated, and only a year had elapsed before she received a proper diagnosis. Her system had not been compromised by many years of inappropriate therapy and unnecessary surgery, so that so many of my patients experience. Thus, her condition did not etch itself into the nervous system and produce a host of associated problems that take years of holistic therapy to unravel and resolve. Oh my God. I'm sorry for chewing gum. Give me a moment. My mouth is so dry. Holy moly. I don't know why. I was just made so much worse by this oral surgery. All right. I'm juicy again. Do I hide it in my jaw? Can you tell? All right. Sorry. It is what it is. Let me just read his little introduction into the pudendal nerve. When I wrote the first draft of this chapter over 6 years ago, my understanding of the pudendal nerve's role in creating the symptoms of urgency, frequency, and IC was just beginning to evolve. Today, this nerve joins the pelvic floor muscles as a focal point of my attention whenever I examine a new urgency, frequency, or IC patient, even though the muscles generally lie at the root of these urinary syndromes. This is because pudendal neuralgia can mimic the urinary symptoms and pain of IC. It can cause tension, trigger points, and associated pain in the pelvic floor and perineal muscles, including the external urethral sphincter and the urogenital diaphragm. When either of these muscles becomes dysfunctional, it can compress the urethra, producing symptoms of urgency and frequency. In March 2008, Furuta published some interesting findings on the pudendal nerve's involvement in urinary symptoms. Based upon an experimental study they had conducted, those researchers reported that pudendal nerve damage could cause urinary urgency and frequency and stress incontinence and possibly IC, and cited other studies to support this conclusion. They believe that an injured pudendal nerve sensitizes the sacral spinal cord nerves S2, S3, S4, which descend into the pelvis I'm sorry, now my eye is weird, to form pudendal nerve trunks. Because these sacral nerve branches innervate the bladder, when they become hypersensitive, the bladder gets irritated. They also indicate that pudendal nerve damage can cause an increase in blood levels of nerve. Yeah, you don't need to know that. The bottom line, in all cases of suspected IC, the pelvic floor and perineal muscles and the pudendal nerve must be examined. All right, I got to go wash my hands now because I got to be able to scratch my eye. I'll be right back. I'm sorry. I'm a freaking mess today, but it makes sense. I've been traumatized. All right. Now, when I wash my hands, I sing the Outlander song. Sing me a song of a lass that is gone. Say, but that lass be I, Mary of soul, whatever. Anyway, that's what I do now when I'm washing my hands, to wash them for 20 seconds. Carol says, what about an episiotomy? Spelt wrong. Yeah, you had one 30 years ago. Yeah, hun, absolutely. Absolutely. We see that. We see that history of pelvic floor trauma. So the question is did the scar tissue from the episiotomy squeeze some essential blood vessels and or nerves, and or is that scar tissue still very tight and restricted, or can it be loosened up? And the odds are it probably can be loosened up. Hello, Kieran. Carol, I got a UTI after the last time I went to a friend's jacuzzi. It was brand new, but I think he put too much chlorine in it. Carol, you know what? I have probably once or twice a year, I get somebody who had exactly that same experience. You'd be interested to know that, my original bladder pain started after a pool accident, although it was a regular swimming pool. And I would have been blinded if I hadn't been wearing my goggles. The pool made a giant mistake with their chemicals that day, and a bunch of us swam. And that was the night my quote unquote bladder pain started. And I couldn't sue because we didn't have any evidence in the form of research studies that proved that pool chemicals could cause tissue damage to the degree that they did, until last year when the Center for Disease Control finally released their first report of chemical injuries in pools. And it's real. It happens. I think they said 5,000 people had been injured by chemicals in pools or hot tubs. Molly, yeah, I know. Obviously, an abuser. Yeah, man, I'm telling you, some of the abuse stories that I've heard, I've had patients share with me are just nothing short of heartbreaking and tragic, and you just want to, you want the person who did it to suffer terribly for what they've done. Mine is not compounded with estrase. Mine is made with a pure estradiol. They do not use any estrase in it at all. There's no point. If they were using estrase, then it would be much more expensive, because estrase is a brand name that just like Premarin. Premarin can cost you $300 to $400 for a prescription. A simple compounded estrogen might cost you $40. Estrase is like halfway in between. If they were using estrase as an ingredient and compounded, your compounding would be much more expensive. Joan says, thinking of going to salt water. That's considered safer. That's for sure. Salt water is definitely considered safer than chlorine. A lot of people have gone to bromine. Bromine is also considered a bit safer. But you should, Joan, you should go over to the Center for Disease Control and go to their Google CDC pool chemical injury and just see what they've got to say about it. All right, time for some giveaways, my friends. It's time for some giveaways. So I tell you what, on Facebook and YouTube, you're each going to get some lucky person is each going to get a copy of this book. Now, if you've already gotten a copy of this book, please, I've already given away 20 of them, 15 of them, somewhere in there. If you've already gotten one, please do not participate again. All right, so we need a question. Oh, and I really didn't do, darn it. Okay. Oh, okay. I have to make you work for it. Like, again, ooh. Okay, this might be too hard, but I'm going to give it a try. Let's try this one first. Okay. The pudendal nerve originates from the spinal cord in 4 locations in the general in a general area. It's not the lumbar area. It's the area below the lumbar. The first person on Facebook and the first person on YouTube that can say the part of the spine below the lumbar area will get the book. But if that's too hard, I will do another one, because I didn't technically answer that question. Does anybody know? I'll give you a minute. So there are 4 nerve roots that come off the spine. Sandra on YouTube got it. And Faith on Facebook got it. Yes, it's the sacral area. Sacral. Okay. So hold on. And so hold on. It is Faith Warner. There is, and then it is Sandra Ciardelli. Okay. You will each get the book. All right. Now, my friends, to save me from inhaling this fantastic candy, I have got seven bars. I've got 7 bars of carob that I would like to give away. Please, God, take it, because these will be down my mouth in a week, all of them, if I don't get them out of my office, because I love carob. All right, so if you would like carob, tell you what, let's just make this easy. Anybody who would like some carob, would you just, as well as our 2 winners, would you please email me icnetwork@mac.com, icnetwork@mac.com, and I will send you the first 7. And if I don't get 7 people who want them, then I will divide all these up by the people who say they want carob. So icnetwork@mac.com, send me an email. And if you want to try carob, I will send these to you free as charge. Okay. And I want to thank Super Treats for sending them to me. I think they're fabulous, and I'm more than happy to recommend them. And I have a link on our website in our store to them also. All righty. Hello, Martha. It's nice to see you. So how you guys doing with your, so we've been talking about the bladder for a while, but I don't know about you, but man, I'm serious. The stress level with coronavirus is bad. How are you guys doing with that? How are you feeling? Joan, you did get it right. You were so close. Are you guys coping okay? Are people staying home now? Has coronavirus affected you? Okay, Nancy, I got your email. Thank you. You guys, make sure you put your snail mail addresses in there. All right. So, Denise, girl, you got to send me your mailing address if you want it. You can't just say you love some. You got to email me back with your mailing address. Both of you. Send me your address. Okay, Angie's going to get some. She sent me her address. Denise and Nancy, send me another email with your address. So how you guys doing with COVID? Everybody okay? Yeah, this is not the right time to be on a cruise ship, that's for sure. I certainly wouldn't get on a plane at all. Joan, send me an email, icnetwork@mac.com, and I will happily send you some carob, okay? All right, there we go. First 7 to give me their address will get them. Hello, Sandy. It's nice to see you. Molly, I will absolutely send you carob. Not a problem. You are very welcome. Though Karen's trying to reschedule some plane flights through Delta. Mac, like Macintosh computer, MAC. icnetwork@mac.com. No spaces, all lowercase. icnetwork@mac.com. Angie says you're scared to go to doctor's appointment. So at the oral surgeon that I was at, they had a big sign on the door. It was really interesting, and I was actually really happy to see it. It basically said, "Do not touch this doorknob if you have a fever, if you have a cough, if you have been traveling, or if you've been exposed to anybody." They told people literally to turn around, get back in their car, go home, and call on the phone to reschedule. And so I saw this and I was like, I laughed when I saw it, and I walked in and I said, so I'm going to ask you guys exactly the same question. Is anybody here sick? Have you treated anybody who was sick? Anything? Because if you have, I'm out of here. And I was really happy to see that anytime anybody came in the door, they immediately came out and they cleaned off the doorknob, they cleaned off the pins, and they were doing a really good job. Now, my best friend is a senior manager for Kaiser Permanente, and she pointed out something really good to me. She said, Jill, you got to remember that hospitals practice sterile technique. And so doctors' offices do too. So the odds are that where you go, they're being so thorough with their cleaning that the risk of you touching anything contaminated with corona is probably quite slim. And I think that's a good way to put it. Hello, Donna. Girl, I haven't talked to you in forever. I was just thinking about you the other day. That's okay. I definitely have your address. You're good. Okay, you guys, you have to email me your address because I'm not going to find it in this, hon. I'm sorry. There are almost 200 comments in here. Yeah. John Lee rescheduling. Yeah, I honestly would reschedule everything. Everything. I mean, they just announced last night that we have our first case of community acquisition in the town where I went to grad school, right? Literally 20 minutes away, a healthcare worker. I'm doing my shopping at night. I last went to the supermarket at 9 o'clock about 3 days ago. There's hardly anybody there. Perfect time to shop. Yesterday, I redid my pantry and reorganized my food, so I know exactly what we have. I'm not hoarding. I'm just trying to be responsible because I've got 3 people to feed instead of just one person to feed. I don't understand the whole toilet paper hoarding, but I went to Costco 2 weeks ago and I bought 3 things of toilet paper. So there you go. If anybody needs toilet paper, it's us, right? And about 4 things of preparation age wipes, just in case, But if worse comes to worse, guys, seriously, use your peri bottle and a towel. You can rinse yourself off clean with a perineal bottle and just wipe dry with a towel, and then throw the towel in the washer. You'll be fine. You won't even need toilet paper. Save your toilet paper for number 2. You don't need toilet paper for number 1 if you're using water. John, and I'm sorry, John Lee. I know that you're not a guy. I know that you're the partner of John Lee. You live in an epicenter for Pennsylvania. We are told to omit non-essentials, period. Some doctors are canceling. Absolutely. Yeah, that's what you got to do. That's what you got to do. Now, listen, I might also be sending some of you our magazine. Some of the people who got the Carob, I might throw in our latest magazine in there too. We'll see. I will probably ship on Tuesday because tomorrow we've got to prep all of our magazines to be sent out. I don't know, man, the stress level is real. I just literally, what have I been doing? I'm trying not to watch TV. I get too angry when I watch TV. I am doing TikTok, which is hysterical. I will watch TikTok. I will. I put out a crossword puzzle. We're doing or a jigsaw puzzle. So now I got my parents doing jigsaw puzzles. I did the jigsaw puzzle last night. We're watching movies, playing games, reading books, and home cooking. Made corned beef and cabbage last night. Anybody else have corn? I've never had corned beef filet or my IC ever. So we had corned beef and cabbage last night. We'll have corned beef and corned beef hash tonight for dinner, which is always really, really, really good. Love it, love it, love it. Especially if you cook it crispy. So so if anybody's prepared, oh, thank you, Loretta. Thank you. I appreciate that. You should change your Facebook name to John and Loretta Lee. Then we would know, and I wouldn't keep calling you John. Cindy says that's what I'm doing, rinsing with water and drying with a face cloth. Yeah, absolutely. Nancy says, thank you. You love listening today, calming. Oh, I'm glad. I'm glad. I don't know if I could have done this last week, aside from my jaw hurting. We have to find our inner calm now with everything that's going on. One thing that I do is I follow Irish sheep farmer. I follow farmers on Twitter, and one of the ones that I love is Zwart Bowls, and I'll show it to you. Everybody should sign up for her. It's Susanna Crampton. So they just had puppies, so a lot of puppy videos. The sheep are now having their lambs, although they just lost one of their sheep suddenly. But her videos are like this, right? I mean, this is beautiful videos of her interacting with the sheep and the other critters. I find these, and this guy is hysterical. Patrick Skinner and his mean cat, and he's a police officer. And mean cat broke the base of his tail, and he couldn't walk, and he couldn't poop because he couldn't do anything with those bones. So that's been quite an adventure. He's finally out of, they call him Gitmo. So I really like here's Susanna. This to me is the best of Twitter right here. And that's her little dog, world's smallest sheepdog. He has his own Twitter account. She has her own Twitter account. So I hope you find things like this. Zwart Bowls, IE, or Susanna Crampton in Ireland. This is the perfect way. Oh my God. Bathsheba had a fourth lamb. Look at that. Here's a lamb that had quadruplets. So this is what I do to just get away from the world. Is I do, and there's one of the puppies playing. Just had puppies. So I wish you all the best, guys. I know that this is stressful, but you can get through this. You absolutely can get through this. I think I'm probably going to do, now that my mouth and my jaw is calming down, I think you're going to see me doing more, as long as we can get rid of this dry mouth. I want to check in more frequently with everybody and see how you're doing. So rather than doing a really long 5-hour stream, I'm probably going to be doing shorter 2-hour streams, but a few throughout the week. So anyway, all right, guys, listen, we've been going 2.5 hours. My jaw has had it. It's starting to hurt. I got to go. I wish you all the best. I will see you in a couple of days. I will plan on doing a stream again, probably on Tuesday or Wednesday afternoon or evening. Okay. So peace to everyone. Lots of deep breathing. You have done nothing wrong. Oh, we have to do your homework. Wait a second. Everybody has homework here. Wait, before you go, you got to do your homework. Aside from reading the book. Well, that's part of it. Okay. For 15 minutes a day, I need you to do something for your spirit and your soul. For me, it's watching baby lambs, going out and taking a walk, going to church, listening to something. Do something that gives you comfort. Honestly, we really need that even more right now. We need a lot of comfort right now because this is a scary time. I need you to do 15 minutes a day for something for your bladder and your pelvic floor. So what did we learn today for me? My pelvic floor muscles are tight. And so for 15 minutes tonight, I have no shame. I'm going to be using my glass wand to work on my pelvic floor. Whether it's you're doing your stretches, doing your down, dead bugs, where you lay on your back is a specific exercise that we do for the pelvic floor and also for your core. So 15 minutes, do something every single day for your body. For 15 minutes a day, I need you to do something for your noggin here. I need you to get your knowledge level up. Because seriously, I had somebody yesterday or Friday call me, and they were like 15 years behind. They knew nothing about any of the new. I mean, it was just Elmeron for her. And she'd been taking Elmeron for years and had eye issues. She didn't even know there were supplements, for God's sake. Yes, we have supplements. We've had supplements for 20 years. Those are options. I need you to do 15 minutes a day of something that makes you laugh. Why? Because laughter minimizes pain. When you're laughing, if you have pain and you're crying, your brain goes, uh-oh, this must be serious, and it will intensify the pain. But if you have pain and you're laughing, your brain goes, oh, this might be okay, pain. Your brain will minimize the pain. So every day, I also need you to do something that will laugh. And for me, it's just generally watching TikTok or watching funny videos. Now, you know what? I do need to say something else here, though. Christy says, do you know what might cause the area under the kneecap to feel hot, like the tissue has a fever? Both of my knees. No, I don't. That's interesting, Christy. I have no clue. I do need to say something though. I've already had some people call concerned about if you can get something from California or any products safely. I want you to know that we have no one's. I only have two people up in my warehouse. One is my sister, and one is our employee. Um, no one has been sick. I do not expect, if any of them is sick, I will not be shipping for a while. If we have any risk at all of any coronavirus in our warehouse, we will shut things down for a couple of weeks to be on the safe side. I had one patient call me panicking just because she was afraid to open anything in the mail. This is my suggestion. If you're getting anything in the mail, whether it's from Amazon or wherever, the reality is you don't know who's touched that box. So I am not bringing boxes inside my house at all. I'm leaving on my front doorstep or in my garage. If you're worried, you can wear gloves and open it that way. If you don't have gloves, you can spray the box with Lysol. Just spray the box with Lysol first, wait a couple minutes, then open the box. And if you're worried about what's packed inside the box, feel free to spray what's inside the box too. Now, granted, you're probably not going to be able to return it to whoever you bought it from, but if you're worried about latent virus, that's a reasonable thing to do. We don't know what this is going to do to the supply chain of the products that patients rely on. I can tell you that Bladder Rest, so Bladder Builder has no ingredients from China. And so for those of you who don't know the supplements, let me just go through them real quick. So let me just go through these real quickly so that you at least know what's out there. Okay. So supplements have been suggested and used by IC patients for over 20 years now. The first supplement that came onto the market was there's a tie between Cystic Q and Desert Harvest Aloe. Cystic Q, the Q stands for quercetin, and we know that quercetin acts as an antihistamine in the urinary tract. And so most of the good supplements have quercetin in them. Cystic Q is kind of gone now. We don't promote it anymore. We've discontinued all those products, but they're still available, but there are better products now than Cystic Q. The second product that was developed was Desert Harvest Aloe. And aloe is an interesting story because this company was started by two sisters, one of whom had IC, and this is 30 years ago, believed that aloe could help. And in fact, this company now 30 years later is still quite alive and well. And aloe has been found to be fairly calming and soothing to a irritated bladder wall or an irritated urethra. The challenge with aloe is that quite a few people are gut intolerant. Aloe is known for causing stomach distress and bowel distress. And so if you're one of those people, aloe would not be suggested. The next product that was invented was a product called Cystoprotect. Cystoprotect's been out for about 18 years. It was created by Dr. Theo Herides at Tufts University, a federally funded IC researcher. And I've told his story before. Tufts, the state of Massachusetts asked him in his capacity as a pharmacologist to investigate the safety of supplements. as he did that work 20 years ago, he came to wonder if some ingredients could be helpful for the bladder. Then he ended up creating Cystoprotect. Cystoprotect was the top supplement for 15 years, easy, until last year when a cancer warning appeared on the bottle because of a white food coloring in the capsule. Cystoprotect was pretty much destroyed last year by this Proposition 65 warning. It has been reformulated. We did get the correct formulation, the new formulation without the titanium dioxide, in late December. And so we now have the correct one. Unfortunately, the company did try, somebody in the warehouse sent us old product last week, and we have to return that back. So anyway, but Cystoprotect is still viable, and quite a few people really depend on this, especially people who've gotten off of Elmeron, or you're worried about continuing Elmeron because of side effects. Bladder rest was created as an alternative to Cystoprotect last spring. And quite a few patients are now on bladder rest. It's got quercetin in it and chondroitin in it and hyaluronate in it, along with some amino acids and some rutin. It's $10 cheaper and is quite popular. I will tell you, this is being reformulated to remove any ingredient from China. There are a couple of ingredients from China. I mean, there's ingredients in China in a lot of supplements and in most vitamins. You got to understand, America sent all of our manufacturing facilities to China 20 years ago. And so getting something that's not made in China is challenging. But given the concerns with coronavirus and the supply chain, the next lot of this is going to remove the rutin and the hyaluronate, and it's going to focus on the chondroitin. The top supplement right now is Bladder Builder. Bladder Builder is sourced entirely in the United States, made in the United States from USA ingredients. And the nice thing about this product is it has many more methods of action. So in addition to the quercetin and the chondroitin for the bladder coating effect, it also has collagen for the bladder wall. It's got some probiotics for the gut. And most importantly, it has an ingredient in it called PEA, palmitoethanolamide, which has been found in research studies to reduce pain and discomfort. And so for patients who are struggling with pain, especially if you've been taken off of or forced off of your pain medication, this is viable because we have research that shows that a combination of PEA and resveratrol is remarkably successful at reducing the pain of IC. Now, if you don't want the bladder coating effect and you just want the pain fighting ingredient, they have that too. And this is the supplement that I take. It's called Peora. And it's just the PEA and the resveratrol. And I take it for my skin pain and my mouth pain. And this has been remarkably helpful for me. I can always tell. And again, I'm a less is more kind of person. I don't take a full dose of everything every day. I'll take one pill every other day or every 3 days, or if I feel like I need it. And so Peora it mimics the formula that was in the big ICPEA study that was released last year. We also have Bladder Smart, which is a low-acid multivitamin. This is replacing Multirite, the low-acid vitamin that we used for several years. This is a much better kind of easier to swallow, smaller capsule rather than a big chunky pill. And we took the iron out for people who had trouble with people who couldn't use iron. And then last but not least, the new one that's coming out soon is called Prevent. And Prevent is for people who struggle with recurring urinary tract infections. And it's like Allura. In fact, it's a better, stronger formula than Allura that will be cheaper in price. So if you're somebody who you have estrogen atrophy and you're struggling with recurring infections, Prevent would be something that would be very easy to try. So there are supplements that are available, especially now if you can't get into the doctor, or we now know that so many of the Elmeron is linked to eye issues. The Overactive bladder medications, the Detrol, the Ditropan, the low-dose antidepressants have all now been linked to cognitive decline and dementia. So more and more patients have just moved over to the supplements, and at least we've got them. I'm happy that we have options, that you have options that you can try. All right. Okay, last call for questions. Last call for questions. Faith says, I'm on my second bottle of Bladder Builder and it is working. I've been able to stop taking cimetidine and haven't taken pain meds in several weeks, hoping to wean off Lyrica. Yeah, baby. Woohoo! I love it. Faith, that is fantastic news. I am so glad that the Bladder Builder is working for you. Keep it up, girl. And we need more testimonials for patients that are helping. And listen, if you take a supplement and it's not working for you, you have a reaction, just know you got lots of other things you can try. Bladder Builder is available exclusively from the IC Network. You can get it in our store, Kristen. So just come on over to icnetwork.org, click on the shop link, and it'll take you right over to the IC Network, all right, to our mail order center. We have a big mail order center where we sell books and chair cushions and heating pads and stuff like that. So we do have most of the supplements too. All right. Okay, my friends, I'm going to stop. Hey, man, not bad. 10 days post-surgery. Only hurts a little bit. I think it'll only get better as I heal. Okay, so I'm going to let you go. I will see you guys later. Have a good one. Be safe. Stay home. Stay away from crowds. All right. Goodbye, Facebook. All right, YouTube. I will see you all later, my friends. Be well.